First patient I would like to talk about today is a 94-year-old woman that I've been treating for several years with a remote history of a sarcoma in her thigh. This was removed. It was surgically negative margin. She was treated appropriately with radiation therapy about 30 years before I met her. She had both an anterior and lateral thigh ulcer that reopened approximately 20 years after it had closed, and it went to the deep subcutaneous tissue. She was treated with debridement, collagen matrix, compression, and upwards of 80 hyperbaric therapy treatments without any healing other than the lateral side of the wound, which was at the edge of the radiation. So the lateral ulcer, I was able to heal in about 12 months, but the anterior ulcer remained healed. We used an extracellular matrix and then eventually placental grafts, and none of these seemed to work or jumpstart the healing on this leg. So finally, I was using Keragel, and after about 8 to 10 months, this ulcer was able to heal completely and remain healed. This is after having it open for about 6 or 7 years. So prior to Keragel treatment, one can see this open ulcer. It's almost 5.5, 6 centimeters in size by 2 centimeters. And that's the best I could get it after approximately 2 years of treatment. After about 1.5 to 2 months, the ulcer now had a big skin bridge in the center, and it was starting to divide. It was significantly smaller. And over the next several months, I was able to get this to heal down. She had a little scab here that eventually fell off. And so 8 months after we began, this ulcer was healed for the first time in about 7 or 8 years. The patient was seen in the office about every 2 to 3 weeks. Telehealth was not necessary, and she remained healed several months after this last picture with completely normal skin other than a scar and some radiation change that you can see with the redness in her skin. Now, we all know that radiation is difficult to heal to begin with, but she was treated appropriately with everything else that she was given and treated with. To talk about this is a very cost-effective option. It's a better alternative to a skin graft or a myocutaneous flap, which would have been necessary to heal this wound because she had healed all other available treatments that were on the market at the time. Radiated tissue tends not to heal well, and she's 94. She did not want to go and have another surgical intervention. So it was ill-advised because just putting a split-thickness skin graft into an irradiated field probably would have failed. This is a non-invasive treatment that was able to be put on at her home. She did not need to come in for me to do skin substitute grafting on a every week or every other week basis. And she was able to have the dressing changed every 2 to 3 days. She did not want additional surgery. So it's very cost effective. It was non-invasive, and we were able to avoid a major surgical procedure in a 94-year-old. Although she was otherwise very healthy. She was ambulatory, she was taking just 1 blood pressure medication.